Let's talk about postpartum or puerperal or postnatal psychosis. It is one of the things which concerns our society a lot. After the childbirth, many a times the female is labeled ki she is doing this because she doesn't want to take care of her child. She is doing drama ki nahi because this pregnancy was unwanted, or she is very young and she doesn't want to take care of the child. She wants to shed her responsibility of her child on someone else and she is doing it. But no, postpartum psychosis is one of the medical emergencies, acute medical emergencies, which needs to be taken care of. It is a psychological disorder, a mental disorder, usually occurring post childbirth, or at times, usually not, but at times also after the abortions. Identifying the women who are at the risk of developing the postpartum psychosis will help us to deal with these patients easily, or at the initial symptoms before the girls, or the females going into the severe category where they need then hospitalizations. To identify the causes, rarely the genetic cause, whether there is some disturbance with chromosome 16 is there. Because of the hormonal changes happening during pregnancy and after delivery, there are hormonal changes which we may feel it difficult to tide over or to tackle with. That is the reason we may get into postpartum psychosis. Or if I have family history or personal history of depression, there are at times families where there is really lack of social and emotional support. The female is left all alone on herself to take care of a child. At times the female also feels the lack, inadequacy, less self-esteem. She feels that she is an inadequate mother, a newly mother. She feels that I cannot take care of the child, I may not be able to feed the child, I may not be able to emotionally connect with the child. Or if there are financial issues, or there are changes in the job, or we have moved to a new place, if there are marital problems, a single parent, the parent who got divorced during the pregnancy or during the course of delivery, the child, again as I said, the child care stress, or if there is a prenatal anxiety पहले से कि अभी मैं pregnant तो हो गई but मैं ध्यान कैसे रखूंगी, how will I take care of my child, because of that also that happens. Many times the pregnancy is unplanned or forced. In that case also, when things are not planned, or if it is imposed on you, it's not by your choice, then we have the tendency of going to depression. In today's era, where substance abuse, alcohol, smoking is one of the major concerns, that also leads to postpartum psychosis and labor pain itself. Our ancestors tell us that all of us have gone through it, but yes, labor pain is. We need to empathize with the female who is undergoing labor pain so that her stress reduces. Very rarely there are organic causes to it also, like ischemic or hemorrhagic stroke or electrolyte imbalance, mostly hypo or hyperkalemia or hypo or hypernatremia, hypo or hyperglycemia where our sugar levels are high or low. The thyroid or parathyroid levels may be abnormal, at times B12 or folate deficiencies, and very rarely sepsis where the delivery has not been taken care of properly. The hygiene care is not taken care, the delivery is done under very unhygienic conditions. Then in that case, if the sepsis occurs, then that may lead into the postpartum psychosis. Now, how does the patient will present to us is like, she may have hallucination where someone is commanding her that please kill the baby, or the delusion that my child is an Masiha, or it can be the Masiha, or the feeling that no, my child is an embodiment of an evil, my child is possessed. The thought process is illogical, insomnia, irritability, confusion. The mother is disoriented, their memory is impaired, there is sadness. Suddenly she'll start crying, she's fatigued, she's tired, she's agitated and anxious. Excess of fear, or at times ecstasy also, stuporous, very rarely catatonia also. At times there is feeling of resentment. It's questions, why did I have the child? Why did I take the decision of having the child? The feeling of inadequacy, the feeling of not being able to cope up with the child care, with the daily requirements of the child. At times there is also misrecognition where the delivered female doesn't recognize the father of the child, where she'll feel that no, this particular person is not my partner and not the father of the child. mood disturbance ranging from mania to depression. Depersonalization is difficult to relate with the environment, feeling detached from the baby, from the family, from everybody who is surrounding us. This has basically repercussions on the mother-child bonding and the mother-child care also. The complications of the postpartum psychosis may be either I may kill myself, that's suicidal, or infanticide. And if someone is saying ki nahi tum aise kar rahe ho waise kar rahe ho, then homicidal thoughts also come. There is lack of bond between the mother and the child. Now how are we going to treat it? If it is very severe, then we need to hospitalize the patient, or mostly we can take care of the patient at the home also. Antipsychotics, antidepressants, anti-anxiety drugs are usually required. Counseling and education. Now, counseling and education should be both of the mother, of the husband, and the family also. Family support is really very important in this. ECT, rest and nutrition. Rest is very important. She really needs to rest so that her mind calms and she can calm down, and then she can really take care of her child.
Eh-Maaya Lab is all about giving you correct information from doctors and experts. For more such content, subscribe to our channel and click on the bell icon so you never miss an update. Also, you can check these videos out.